back to the Wellness Check. It's been a little while since I posted a video. I'm sorry I've been out of town, but I am back, and I wanted to talk today about everything that happens before trauma processing with your therapist occurs in the office. I've had even clients ask before, are we doing EMDR today? Are we doing brain spotting today? I don't know if I'm ready. And the answer is no, we're not doing that on the first day of an appointment. There's a lot of groundwork that has to be laid and should be laid with a client to gain rapport, to gain trust, to get a full background history from every client before going into the processing work. So today I wanted to tell you a little bit about what to expect with all of the stuff that happens before you do trauma work with your trauma therapist. If you've never been to therapy before, it can be scary. It can be a little daunting to think that you're going to be in a box like this with your therapist for an hour, unveiling all of your darkest, deepest secrets. And it can be, but also we take it at your pace. So at least for me, I'll speak just for myself, we're going at a pace that feels appropriate and safe for you. And there is a lot of education that happens in here with what to expect, a lot of question and answer on what is the process like. And there are very specific things that I have to check off of my list to implement and help you learn and understand about yourself before we ever go into EMDR or brain spotting. So I wanted to go into what that is today. A first session with a therapist is different. It's different than the ones that come to follow. There's a lot of questions that are asked about you, about what you like, what you don't like, what are you here for, what are you hoping to focus on, how can I as a therapist get to know you and help you with what feels important and relevant to you. And with that, you can go into as much detail or as little detail as you want to go in. It's just kind of a get to know you session. And there's also a piece where the therapist can talk about what to expect. This is how therapy works. If you get sick or if you have to miss an appointment, this is what we do. This is who you call. This is what happens. This is how we reschedule. All of that stuff, all of those questions get answered in the first session. So hopefully the person leaving their very first therapy session feels as though they have a game plan, a treatment plan. They feel as though they were able to discuss the important parts of why they're here and what they want to work on, as well as just kind of knowing the logistical, administrative, more boring parts of how therapy works, just in case there's ever an emergency or ever a time where they need to reschedule or what have you. Okay, so that's kind of the way the first session works. After that, we start getting into the deeper forms of treatment planning. And a lot of people that come to me are specifically coming to me because they want to do EMDR or brain spotting. They want to do the trauma work and they want to feel better. So with that understanding, it's important to know, have you done this before with any other therapist? Have you done trauma treatment? Have you ever told your story to anybody? Where are we in this healing process? Are we starting from square one? Or have you been in therapy for 15 years and you've seen 2 EMDR therapists and things are great? You just have some additional things you want to work on. All of that is really important to know too, because I want to meet you and your EMDR therapist and your brain spotting therapist. They want to meet you where you are. And the treatment will look a lot different if this is your first ever go around and if we're helping you to even feel safe and comfortable enough to say the words of your story or even approach it or be open enough to talk about it versus someone who is very well versed with their story, doesn't mind talking about it, and has done a lot of work around it already. Nevertheless, no matter who comes in my office, there are some things that I need to make sure my client knows before we start. So I tend to do at the very least three different grounding exercises. And I've explained these exercises in other videos before. I've shown you how to do them, and I've talked about them in previous videos. But one is the safe and comfortable place. With that exercise, you get a little experience of what bilateral stimulation is, which is the fancy way of saying left, right brain hemispherical stimulation, which is what we use in EMDR. We get you well versed in the safe and comfortable place. We do something called the emotional pain release technique, which is an amazing one. It's one of my most favorite things. It's a guided meditative exercise that helps you really get in touch with your emotions, but also to help flush it out of your body and replace it with something that feels more pleasant, more calm, more safe. Emotional pain, safe and comfortable. I do something called the container exercise, which is a compartmentalization technique so that people can get through their day more successfully with intrusive thoughts or anxiety, memories, urges, cravings, you name it. We can just kind of contain it and compartmentalize it more effectively so that when you're able to or have the time to handle it more effectively, you can, instead of it just bombarding you throughout the day. Those are the three main ones, but there are lots of other things we do too. Depending on the individual, we'll do screenings for levels of PTSD, the spectrum of dissociation, all of those things, because I need to know as a clinician, is this person inclined to dissociate? What does that look like for the client? How can I help? What is the intensity of this person's PTSD symptomology, or however you want to kind of call that? How is their experience impacting them, and to what degree? What else? A lot of breath work, a lot of what I call window of tolerance work. There's a video on that too. Go check it out. What is window of tolerance? It explains it in a previous video. I help my clients to regulate, to understand what their tolerance levels are for their feelings, for their thoughts, their emotions, their physiological responses to these things. Not only to help them understand how they react when they think about certain things or remember certain things, but also how to bring those levels down or up if they need to. It's a huge regulatory support system, and it's called the window of tolerance. So you hear me using those terms a lot in our work together. So all in all, it's very important for me as a clinician, but even more importantly for you as a client, to begin feeling really safe, familiar with the office, familiar with me, a chance that you've told your story to at least to a certain degree to where we know how to pinpoint the trauma treatment together, and that we've done everything we can in terms of answering questions of what is this going to be like? What does EMDR feel like? What is there to expect in brain spotting? How does it work? We go through all of those questions together, and we have that foundation of the emotional regulation exercises with those ones that I just mentioned, but there's also many, many, many more. And it just depends on the individual which ones we pull out and use. So after that, we tend to go into the trauma treatment itself, and that's something we explore together. Is someone more comfortable with brain spotting or EMDR, or do we use both in conjunction with one another? You can do that, and it's pretty magical when you're able to combine techniques of EMDR and brain spotting together. And what does that process look like? It's very individualized. So I wanted to make this video because I talk a lot about what the interventions are, what trauma treatment is, and it might make it sound like that's what happens the first or second time someone comes into my office, and it's just not. And it shouldn't be. And to me, that just feels a little rushed and irresponsible. I want to know you, and I want you to know me. And I'm speaking for all of the trauma treatment specialists out there. That's the name of the game. We want this to feel safe. We want you to hold the reins and have the control in the session to decide how far we go, how far we don't, what we talk about, what we don't talk about, and have it go at a pace that feels safe for you, but also in a way that we're able to follow that treatment timeline and get those therapeutic goals met. because that's why you're here. You want to feel better. I had a question that was brought to my attention, and it was something to the effect of, does your body just kind of intuitively know how to start processing when you're doing brain spotting or when you're doing EMDR? If you find the spot, does your body just know what to do with that? If you find the target for EMDR and you start going in, can you just do it? And there's an answer to that, and it's yes and no. Yes, I'm going to go with the yes first. Yes, your body knows what to do. Your brain knows what to do. This is the most direct way for brain healing and body healing when it comes to trauma work and processing. So it's innate, if you will. It's built into your system. Your body absolutely knows what to do with it when you find the spot and you start processing. It's natural, okay? But that doesn't make it appropriate to just start it guns a-blazing right out the box. It is natural, it is innate, it is something that your body and brain are designed to do very effectively. You know, brain spotting and EMDR simplify the trauma treatment process. However, we need to put in place that foundation. We need to put in place the get to know you process and the background history and all of the support that one can tolerate or is interested in, because we don't know through that processing how someone might feel. EMDR sessions and brain spotting sessions are different. Every single one is different. There's not a way for a clinician to know or predict what's going to come up, what material is going to come up in any EMDR session, any brain spotting session. And there's no way for a client to know either, even if a lot of pinpointing of the target has been made. So sometimes sessions are very empowering and they feel good, and someone leaves the office feeling just on cloud nine. And sometimes sessions take a direction and they're very hard and they're painful, and we're talking about experiences that are very personal and very deep. And sometimes there's crying, and sometimes there's feelings of loss and devastation. And it's during those sessions that we have to have accessible all of those skills. The emotional regulation, the grounding work, everything that we can do to keep you in that window of tolerance so that you feel safe, so that we're not re-traumatizing you, and so that no matter what comes up in the processing, you feel as connected and safe as you can. Not only that, but many people use these skills after therapy. I mean, just because you walk out my door after processing for an hour, it doesn't mean necessarily that you're just calm, cool, collected and you're ready to go on with your day. Sometimes people feel sad or angry, or sometimes people have dreams that night or the night to follow. And if you just go straight into processing, which your mind and body naturally want to do and willingly do, you have to have these things in place just for safety and just to make sure we're covering all the bases. So I hope that answers some questions on what is it like to start therapy with a trauma specialist? What does it feel like in the sessions? Do you just get straight to it or do you not? Do our bodies and minds want to process? Does that come naturally? Well, now you have some answers. So I encourage questions. I love questions. I'm more than happy to answer them, make videos about them. The more we all know about ourselves and our own world, this perspective that we have through our own experiences, the more we can not only help others and relate to others and love on others, but the more we can heal ourselves as well and make that process just a little less scary and intimidating. Thank you for checking in with your wellness. I hope you have a great day, and I'll see you soon.